All right, everyone, we might get started. I think everyone's on mute already, which is great. So welcome to the 7th session of the 8-week series of the Taping and Moving series, brought to you by Elastoplast. All of these sessions are free and will be presented by industry professionals from a variety of sporting backgrounds and physio specialties. So thank you very much for joining us tonight. My name's Kerryn Harrington, and I'll be presenting tonight's session on ACL injury, the mechanism, some of the rehab, and some taping techniques specifically for females. So just a little bit of background on myself. I am a physiotherapist and I'm currently working at a couple of private hospitals here in Melbourne, predominantly in orthopaedics. And I also have experience working as a physio in private practice and also in the AFL system, working as part of the physio team here at the Carlton Football Club for 3 years. On top of that, I've also spent the last 4 years playing in the AFLW for Carlton, and spent before that 10 years playing in the professional basketball leagues here in Australia. So that's a little bit about myself. Just before we get into tonight's presentation, just a little bit of a reminder that Elastoplast is controlling the session today. So if you have any questions, please direct message them in the chat forum. There's a large number of people on tonight's call, so please, if we can get everyone to remain on mute until the time comes for the floor to be open for questions. And if you do have a question, please feel free to direct yours through the chat function. Send it to the Elastoplast administrators there. And I do apologise in advance if I don't get to answer everyone's question if we do manage to run out of time. Last reminder before we do get rolling is for any products, please make sure that you read the label and follow instructions for use. And if symptoms do persist, please have a chat to your health professional. Very good. I'll do my best to share this screen. Fingers crossed it goes well. Beautiful. That looks like it is going to work. So as I said, tonight I'm going to be presenting on the mechanism of ACL injury. It's quite a hotly debated topic within the AFLW in particular. I will be specifically referencing the AFLW. However, most of what I'm going to be talking about tonight certainly does relate and have, I guess, a lot to do with netball, basketball, soccer, which are the main sports that are played by females here in Australia. So please, if I do mention AFLW, I'm also referring to the other sports as well. And some of the rehab that's involved after ACL rupture, and then just specifically some of the taping techniques in females, because there is some quite subtle differences that I'll go through between taping males and females for any sports trainers that are on the call tonight. So just again, the overview, like I was talking about, prevalence of the ACL injury in female athletes in the AFLW, the mechanism of how it occurs, and some of the research behind the topic at the moment. I'll quickly just mention some of the prevention programs that are available, not just for the AFLW, but for other sports in the country and around the world as well. Like I mentioned, some of the taping specific techniques for female athletes, and then just some really simple, what we call prehab exercises. They also can be used as rehabilitation exercises. Prehab meaning preventing injury in the first place. So I'll go through some of those. Hopefully we've got some time at the end to do a few that anyone can employ in any setting without too much equipment in any of the football change rooms or netball, basketball facilities that you've got available. Very good. So in 2019, the female participation went up quite a lot for AFLW, and that is not just for the juniors. It's obviously for seniors and for underages as well. It's essentially after the overwhelming success of the AFLW in 2017. There's been a predicted exponential growth, and that's only going to continue to go. We don't have the figures beyond 2019 at the moment because of the COVID interruption from last year. Most of the females that are coming to football are crossing over from other codes, as I mentioned, from netball, basketball, soccer, athletics, hockey, wrestling. We've got a number of different athletes that are coming across, and firstly and foremost, that presents a bit of a challenge when the crossover of sport and what athletes have been used to training their bodies to do. The difference is coming into footy, which I'll touch on a little bit later on. At the moment, we're roughly seeing a 14% increase in female participation year on year. And whilst that's a huge number of, and obviously there's been quite well reported, a lot of injuries that have occurred from that perspective. There's a number of other challenges that come with that in terms of facilities that are available not only at an elite level but at sub-elite and junior levels as well, in terms of resources that are available for young girls and the pathway programs that are available, and I will touch on that a little bit later as well. But for the moment, roughly 1 in 3 people playing AFL in Australia are female. So that's a quite a significant jump from where the sport was even 5 to 10 years ago. Unfortunately, females are 9.2 times more likely to do an ACL injury than playing males in the AFL. So what that essentially is telling us, history and evidence, is that the more females that we have playing the sport, the higher the incidence of injury. It is quite an inflated number compared to other sports in the country. So for netball and basketball, depending on where you read what evidence, the number of incidents is, compared to male counterparts, is anywhere from 6 to 9 times more likely to suffer serious injury. And I'll go through some of the reasons why that occurs. But particularly at the moment, if you're from Victoria, you'd be well aware during AFLW season how highly publicised injuries within the AFLW are, and in particular the ACL injury, because of the substantial length of time that it takes to, that it requires to get back to playing elite sport, but also the financial and emotional impact it has on our players. So it is quite a significant jump in comparison to the boys. And again, I'm going to go through why that is in a second. So just as a little bit of a refresher for those either who are new to anatomy or just need a little bit of a refresher. So what we're talking about when we refer to the ACL is the anterior cruciate ligament, and you can see where it's in the middle of that diagram on the left-hand side. So essentially, it runs diagonally from the middle of the knee, in the middle of the knee, from the front to the back, if you're looking at it from the anterior or the front of the knee. Its purpose is one of the major stabilizing ligaments of the knee, as it prevents tibia or the shin bone from sliding out in front of the femur or the thigh bone. So if you can imagine, you've got your knee joint is where my fists are meeting. The ACL prevents the forward shifting of our thigh bone over the top of our shin bone. And that is important. A little bit later on, I will reference that movement when we're talking about the reasons why females are more likely to do this injury than males. The other purpose of the ACL is to provide a rotational stability. So a lot of the injuries that we're seeing is when a player, whether it's male or female, has their foot planted on the ground and their body and their knee rotates away, and you get that rotational torsion force, and that can cause rupture of the ACL as well. Why it's such a significant injury is that ligaments are a really fibrous tissue that have no nerve supply or blood supply. And the reason that's important is that without nerve supply or blood supply, it can't heal itself. So unlike muscle tissue or bone tissue, which regenerates itself once there's injury occurred, the ligaments in our body can't. So that's why it requires more often than not surgical intervention to be able to repair the ACL. So the big old question is always why? Why is this the case? And we break it down into 2 components. So there's non-modifiable risk factors. And the question that I'm trying to answer here is, why are females more likely than males to do this injury? So the non-modifiable risk factors, and then modifiable risk factors. And clearly the ones that we're interested in are the modifiable risk factors that I'll talk about a bit later on. But some of the non-modifiable risk factors are the anatomical differences. So this diagram that I've got here is probably the easiest way to demonstrate what I'm referring to. If you have a look on the left-hand side here with the male anatomy or the pelvic alignment, there's quite a straight femur with the Q angle. Compare that to the females on the right-hand side of the diagram, wider hips, wider the greater trochanter, which comes down, creating this greater Q angle. This is important. The Q angle not necessarily has got a great amount of evidence as to why females do their ACL more often than not, but the theory behind it is that the directional pull of the quadricep muscle is on more of a slant than what it is with the boys. So coupled that with an increase in a lateral tibial slope, a decreased intracondylar notch width where the ACL actually sits within the knee joint, a smaller, we've lost that, sorry. a smaller ACL ligament itself in comparison to the boys, so less margin for error, I guess you could say, for a better word, and what we call lower extremity valgus. And this is probably a little bit more important when you consider the angles that the hips come into the knee, and it creates this motion where the knees almost kiss themselves on the inside of the knee. So if you have a look at the boys, a pretty generalized diagram, there's greater width between the knees, and for the females, it comes in a lot closer. And again, you'll understand in a second when I explain why that's important. Other than that, and it's again quite well discussed at the moment, is the hormone contribution. So every month, female bodies release hormones, in particular estradiol, relaxin, progesterone, have all been shown to increase laxity of the ligaments in the body. And at the moment, there's some research that's suggesting that the period post-ovulation in the menstrual cycle, when progesterone is high, that it coincides with an increased likelihood in injury. At the moment, we don't have anything definitive in this area, but there is a mountain of evidence going in and across this space in many areas of female sport at the moment. So, we're hoping that in future we're going to know a little bit more about the hormonal contribution to injuries, and in particular ACL injuries. But for now, it's a bit of a running theory. Similar to the family history, there is some theories that are going around that suggest having a family history of ACL makes you more likely. Again, there's not enough evidence to suggest that at the moment. It may have more to do with anatomical differences and those sort of things that predispose that runs in a family, not necessarily the fact that you've ruptured an ACL in the first place. Again, we don't have enough evidence. They're just theories at the moment. The ones that we're more interested in are these modifiable risk factors, because these are the ones that we can change. We can't change anything else that I've just talked about. The way that the female body is developed is what it is, and we don't have an opportunity to change that. So the things that we do have the ability to change is the discrepancies in neuromuscular movement and muscle activation patterns. And this is where we see the biggest difference between males and females. If you have a look at this diagram here, and I'll sort of explain it as I go through, but the jump landing mechanism. So if you consider that a safe landing position when you're considering jumping and pivoting in sport is a position where you've got increased knee and hip flexion, so bending of the knee and bending of the hip. There's been a study that it's quite old now that was completed comparing males to females in what we call a dynamic cross-cutting or a side-cutting maneuver. So if you can imagine running quite fast in one direction, planting your foot and being able to change direction at speed, it's what we call a side-cutting maneuver. And this particular study showed that females performed these moves with less knee flexion, less hip flexion, and more of that knee valgus, where those knees come together, than males. And they also prove that females tend to have less hamstring activation than males. And if you go back to my analogy before of my fist meeting, knowing that the ACL prevents the forward moving of the femur over the top of the tibia, when you consider that we have less hamstring, which is that stabilizing muscle being activated, females are probably more likely to end up in that shifting movement. The most common mechanism of this particular injury is that dynamic valgus, where that knee's coming in with the landing, cutting, or the pivoting movement. And interestingly, 70% of ACL injuries are of a non-contact mechanism. So what that means is that it's as a result of the athlete themselves and the movement that they produce. So obviously that leaves 30% of ACL injuries being contact injuries, where either a player or something falls across someone's knee. Often again in that sort of quite vulnerable position where your knees flexed and your knees are coming in that valgus movement together. So 30% of injuries occur that way. Unfortunately, there's not a lot we can do about that. You sort of tend to talk about a little bit of bad luck, but when you consider that 7 out of 10 of these injuries are created by a player's own movement, quite often with not too many people around, it's quite a big number that we can prevent. And just from a neuromuscular standpoint, we know that females take significantly longer time to generate what we call hamstring torque for knee stabilization. And that just goes back to the point I made before, that we tend to recruit our quadriceps muscle, so the anterior of the front muscle, first before we recruit the hamstrings. So automatically we're going into that position before our hamstrings come and stabilize us. If we're put in that position and we have a slow hamstring contraction, we tend to go forward into that position rather than stabilizing and maintaining good position. So the good news for us, though, as females, is that these modifiable risks means just that. And through training improvement, and in particular on these factors, we can significantly reduce the risk of injury. And I'll go into that a little bit more later on. But, we're doing a heap of work within the AFLW at the moment about training these neuromuscular patterns of jump landing, working on that hamstring strength so that we do recruit hamstring muscles before, or at least shorten the gap between where the quadricep muscle and the hamstring muscles co-contract so that we get that stabilization quicker than perhaps what it's been in the past. So it is good news in a way because it is modifiable. Some of the other things that are modifiable is a high BMI. So for those who haven't heard of BMI, BMI is your body mass index. So those girls that have a higher BMI or tend to be perhaps overweight or heading up into that bracket, they've been found to have a significantly increased risk of ACL rupture. Unfortunately for females, this doesn't equate to males as well. So the research tends to suggest that it's only the females that are perhaps affected by the high BMI. It's pretty low level evidence, but it is still there. Some of the other things that get talked about is the playing surface. So often they'll say that harder grounds tend to increase the risk of ACL in comparison to sort of more softer grounds. Again, we don't have any evidence to suggest this, but perhaps in future we may. And the other thing is footwear. So again, there's some pretty low level evidence that's getting around that suggests the number of cleats or stoppers that are on the bottom of boots and higher torsional resistance is associated with an increased number of ACL injuries. Again, we don't have anywhere near enough evidence to suggest that that's a big risk factor, but certainly it does get reported on and it's worth mentioning. The last one, and this does directly relate to the AFL as opposed to the other sports, netball, basketball, hockey that I've referred to, is the game itself to blame. So these are pretty sort of stark figures when you consider them, and particularly when you consider that females, a lot of the girls, a large percentage of the girls that are playing, whether it be at elite level, sub-elite level, or even in the juniors, are coming from other sports. So they've either trained their whole life in one particular sport, or not at the level that they're currently playing at. They tend to jump up because if you come into AFLW at the moment, you'd pretty quickly, if you've got any skill, find yourself in a VFL program, which is a pretty intense sort of program. So there's some specific movement characteristics of football that increase fatigue, leading to a further increase or risk of ACL injury. So the total distance covered in a football match play is approximately 12 kilometres compared to netball, which is 4.2 to roughly nearly 8 Ks. So you've already increased, if you look at the figures there, 25% more game time, leading to more fatigue, in the muscle strength. And if you then relate that back to the fact that neuromuscular control is a risk factor for ACLs, it's pretty easy to see why that's the case. There's a 60% increase in higher intensity effort compared to soccer. So if you consider the length of the ground in AFL compared to soccer pitches, you consider the likes of midfielders and the fact that they play 100% of the ground in comparison to soccer, where it's a little bit more, segregated into your positions and those sort of things. And there's less recovery time in between high velocity running efforts. So, 17% recovery time in comparison to 38% during soccer and 52% during rugby. So there's a lot of, discussion around, is AFL safe for females? There's a lot of research that's going into whether this, if there's any modifiable rule changes that we can make that can perhaps help with the lessening the risk of injury. And that's not just ACL injury, that's obviously, concussions and a whole heap as well, which, we could probably spend a couple of hours talking about that. So I will move on, but it is worth just mentioning as well. So what are we trying to do about this? And there is a heap of money and investment being poured into ACL prevention programs. And, particularly in the AFL, because it is such a, hotly debated topic. There's a lot of media surrounding it, but also the impact financially, physically, emotionally that it does take on our players. So clearly, it doesn't just affect, none of us in AFLW are full-time, and it obviously gets less and less in terms of resources for rehabilitation as you go down towards the community levels of football. So if you consider an ACL injury and the incidents that it causes, it's certainly the trade-off of the rehabilitation might not be worth investing for some players to play. So, clearly the AFLW is very interested, as well as other sports that you can see there, that I'll mention in a second, in reducing the risk of this particular injury. What we know about ACL prevention programs is that between 30 and 52% success rate at reducing injuries. At the moment, we don't have a heap of evidence on the specific female-related programs. And the reason for that is that they just haven't been around long enough to get the data. However, the anecdotal data that is coming out, it's quite in its infancy, but it is coming out, and it's very, very strong to suggest that if you do these programs, that you do significantly reduce the risk of this particular injury. So for anyone who is out there listening tonight, and you are interested, or you run a sports program, or you're a trainer yourself at a club, I really do encourage you to go and have a look at these particular programs. They're all created by, particularly the Prep to Play and the Knee program, by universities that are pouring a heap of resources and funding into these to try and get the best programs available out there. And they're not just for the elite players, they're for sub-elite players and also for juniors. So if I refer to the knee program that Netball Australia has created, it's a terrific program that has the same program essentially from 8 to 11-year-olds right through to the elite players, and you can pick and choose the level that obviously to the audience that you're delivering to. The Prep to Play one, as I mentioned, is the AFL specific one. It's AFLW specific. There's also, it's called the Footy First program. So that's a general strength and conditioning program that the AFL's created. And both these resources are available on the AFL website. And I do encourage you to go and have a look at it, because it is doing really great work within the AFLW at the moment. Netball Australia created the knee program, which was probably, I think off the top of my head, the first program within Australia that was created. And again, Netball recognised the fact that the ACL injuries were creating quite a rife through Netball Australia, and they wanted to do something about it. The most widely known program is the FIFA 11 Plus, and that one, I'd be lying if I knew how much money they poured into it, but it would be in the absolute millions that FIFA created to stop ACL injuries and injuries in general across the world. So that's probably the most well-known and well-resourced program. So it's a great one to go and have a look at. And the one that's been around the longest is the Santa Monica PEP program. It was created, again, I think off the top of my head, about 35 years ago. So this sort of knee problem that it keeps getting called in the media has been around for quite a while, and this particular program came out of the States, I believe, and it's directed at female soccer players. So I do highly recommend that you go and have a look at them, but we will go through some of the exercises quite quickly of the Prep to Play. In terms of rehabilitation after ACL surgery, so something to consider is the surgical versus non-surgical management. Anyone, I guess, who undergoes an ACL injury would always be presented with the option, I think, of a surgical versus non-surgical management. And we tend to go as physios and put them into two categories, and we call them copers or we call them non-copers. And what we mean by that is often after a period of 8 to 12 weeks where the knee has a chance to settle down and what we call a quiet knee, so free from swelling and inflammation, had the opportunity to start recovering some of the strength that you lose through the injury, then we make a bit more of a good judgment on whether this particular person would go well with surgery, whether they need surgery in the first place, or whether they just won't cope and they're not a great candidate for surgery. So often things that are taken into consideration are goals for rehabilitation. So are you trying to return to pivoting sports? Are you happy going skiing every winter? Do you want to be able to run around with the kids in the backyard? Those sort of things. So it's certainly something that if you do have players or of people that have had an ACL rupture, then it's not always surgery. Sometimes there is the option to go down the non-surgical pathway. The Melbourne ACL Rehab Guide, which you can see on the left-hand side, there is a really popular and common ACL rehabilitation pathway that a lot of physios are following for their patients at the moment. It's a criteria-driven process. So in the past, it's certainly been more of a time-based rehabilitation or recovery, whereas now it's a criteria-driven. So you move from phase to phase when you tick all the criteria boxes. You can see the 5 phases there, right from recovery to surgery to return to sport and prevention of re-injury. What I would mention is that all ACL rehabilitation programs are guided by often the surgeon or a qualified health professional, be it a physiotherapist or the like. So what we might move on to now, just to get into it, is just some of those taping techniques. So I've been fortunate tonight to be joined. I was just stopped sharing that. Bring up that. Hopefully. Oh, hopefully this is going to work. I've got Mimi Hill with me here, who's an AFLW player. Jump up on the bed, Mim. Hi, everyone. So what I thought I would start with tonight, if I can get that camera in the right spot, is just going through some of the different taping techniques specifically for females. One of the, I guess, biggest consideration that we have when we're talking about taping females in comparison to males is the size of the joint that we're trying to tape and what we're trying to do with it. More often than not, the size of tape comes into, I guess, the first part of the consideration. The 50 mil tape is probably, particularly when you're considering taping an ankle, is probably too wide. We tend to opt for the 38 mil as it tends to sit on the joints a little bit better and not get too many creases. So what I'll get you to shuffle yourself down, hang your ankle over the edge. So as always, when we're considering taping, we want to make sure that the skin itself is nice and prepped. I would make sure that Mim's not allergic to any of the tape that I'm about to use, and make sure that the skin's nice and clean and dry. Typically, in the females, unlike the males, we tend not to have to worry too much about the hairy ankles. But what we do have to consider is that most of the girls will moisturise their legs frequently, particularly in the summer, and often that can create an oily barrier to the skin. So you might need to use either some spray, adhesive spray, get the girls to wash their ankles and make sure that there's no soap or oil or anything like that that's on the skin. So the next consideration, particularly when in the AFLW, quite a lot of the girls will tape their ankles frequently. A lot of them have come from basketball or netball where they've had ankle rolls and injuries and things in the past, so they're quite a common occurrence. We tape it, particularly the girls that tape their ankles quite frequently might tape them up to 6 times a week. So the one thing that you do want to be really conscious of whenever you're taping is that you use either some sort of protection across the front of the ankle and particularly behind on the Achilles, as these tend to be the areas where if you're going to get tape cuts or friction areas from the tape, they tend to be the most common. So I've just got a little bit of the Lucafoam light here that I'm just going to put over the top. And it's just, again, where the area of the skin that is a bit more prone to having some tape cuts, and the same across the back of the Achilles. Another common injury for the girls that we see is Achilles tendinopathies. And so quite often taping the Achilles quite firm can give them irritation of the Achilles. So it's something to keep in mind when you are taping if they do have Achilles tendinopathies or they get sort of a sore heel or anything like that, that you can avoid taping across the back of the Achilles. But thankfully for tonight, Mim doesn't have an Achilles tendinopathy. If she did have quite sensitive skin, there is options for the under wrap or elasto wrap that you can use that can coat sort of a greater area of the skin. We tend to avoid this if we possibly can because, I mean, taping is really only effective the more that the tape surface is actually on the skin. So I would only ever use that in an example where the player gets a really overly sensitive skin, but definitely the more that we can get the tape to cover the skin surface, the better. So as with all of our ankle tapings, we like to start with, just come out of it for a minute. We like to start with the anchors. It's really important not to go too tight around with the anchors because what that can do is actually inhibit the calf muscle for contracting. So when the girls are out running and jumping around, if you've got quite a firm anchor around the calf, you may be inhibiting the calf from actually producing full contraction. So we'll do 2 of these anchors, and they're our starting point for taping the ankle. What you want to ask the athlete to do is to keep their foot in this neutral position. And the other thing to consider is what you're trying to actually achieve by taping the ankle. So more often than not, the ankle injuries occur when the foot is rolled towards the middle and we get this lateral ankle sprain on the outside. So when you're considering taping, you're trying to not allow the foot to go into that position. So keep that in mind when you are taping. Girls tend to get a bit distracted when you're taping their ankles as well. So you might have to constantly remind them to keep their foot in this position. Another tip is that I get and use my leg to hold their foot up into that position as well. But Mim's quite rehearsed, so she's going to do it for me tonight. So the next stage is the stirrups. And I tend to always go from the inside towards the outside. Lay the tape down, tear it off the roll. I think you can see that there. So you tear it off the roll. And then you're going to put a little bit of tension, but you're not wrenching. You're just putting a little bit of tension and laying the tape down over the skin. What's really important, particularly when you're considering the stirrups, is you've got the bottom of your 5th metatarsal, and it's quite easy to palpate when you feel through there. You don't want to tape beyond that 5th metatarsal. And the reason for that is that by the time Mim stands up and splays her foot, if it's really tight and restricted around that 5th metatarsal, it's really, really quite uncomfortable. So when you're taping with the stirrups, making sure, and you can find it quite easy, it's about halfway up the foot. It's a really bony sort of bump that sticks out. You want to make sure that you're taping behind that. So we'll do 3 stirrups. And what we're aiming to do with these, we don't want to follow the exact pathway of the previous one. You want to overlap by about half. And again, a little bit of tension, but not to the point where you're pulling or wrenching the ankle in any particular direction. And you can always check your work by just giving a little bit of that movement towards the inside, and it's already starting to prevent that movement. So we know that we're on the right track. The next part is the figure 6s, and you do these both directions. Again, I always start from inside out first. So same deal, you tear the tape off the roll, and instead of coming up this time, we're going to come across the front of the ankle and finish back where we started. And we'll do 2 of these each direction. And the same thing, we're not trying to follow the same path. We're going to overlap by about half. We go 2 from inside to out, and then come back the other direction. And again, if you want to check your work, you just make sure that you're not allowing that movement where the ankle rolls. The last thing that we want to do is a heel lock, and this is probably the most complicated part of an ankle taping. Some people call it a basket weave, and basically what this does, as the name suggests, is just locks the heel into position. So we want to start taking enough tape off the roll. We start in that almost 45-degree position across the ankle, come around behind the Achilles, following around the heel, and then back up and over to where we started. And again, we're trying not to pull too much on the tape. We don't want to make it too tight. The tape itself will be the support. You're just helping guide the direction that you're after. And then we do the same back the other direction. So starting at the top on a 45-degree angle, around the back of the Achilles, under the heel, and then up and over back to where we started. And that's as simple as ankle taping gets. Everyone does ankle taping a different, like there's plenty of ways that you can do it. Everyone will have their differences that they do. As long as you understand what you're trying to achieve and that's what you've got at the end of it, then you can't go too wrong. The other thing that I would always do is lock it off at the top. You can do one or two of these depending on player preference. And something that I've learned not only as a player but as a physio as well is that if you've got any spare space at the back, try and cover it with a piece of tape. It just has to be a little bit to stop and prevent any friction or tape cuts. And that's as simple as taping gets. When you consider taping these, and we're probably going to run out of time, so I won't do that today. There's plenty of different videos online. The same thing goes, you want to just make sure that you've picked the right tape. If the tape's too big, it won't follow the natural line of the girls, whether it's their knee, elbow, finger, whatever it is that you're taping, similar to the ankle. And make sure that you're covering it, particularly in football where knees are often driving into the ground when they're tackled. Make sure that you're covering it with one of the overwraps or the elastic adhesive bandage here. The other thing that you can do, if you bring your ankle back up, Mim, particularly if you've got a player who has had or wants a little bit of support, make sure that you go over the top with the adhesive band in the same fashion that you did the heel lock. So you can go over, keep coming around the back, and then back up through the front. So it can just provide that little bit of extra stability. And the players, they might want one or two of those wraps depending on how firm they want their taping to be. These ones you can't tear, so you have to use some scissors. And you can go over the top and just lock that down with the adhesive. Beautiful. All right. What we might do quickly, Mim, is just some of the prehab exercises that we talked about. So the exercises that I'm going to show and get Mim to do tonight is some of the ones that have been adapted from the prep to play. As I said, I do encourage everyone to go and have a look at the particular programs because they are full of information and really quite easy to follow. Some of the ones that we here at Carlton do before every training and warm-up that we do just to get ourselves activated and ready to go is first and foremost just some basic squats with some resistive elastic band. So, I mean, if you... So it doesn't need to be too tight. They do break easy, so you get a big roll of them, that's for sure. So I'm just going to go into the squat position. And what this is doing with the band is it's actually causing Mim's knees to come together, which is that valgus movement that we were talking about in the presentation. So Mim has to work really hard with her glute muscles to be able to force herself out, activating up through her hips, which is really important. You can imagine being in this flexed hip, flexed knee position that we were talking about when we're out either playing football, netball, or basketball. If we can train our hip muscles to be creating the knee alignment like this, then we're going to have better chances of staying out of that position where our knees come together. So Mim, I'll get you to do 4 or 5 of these. So up and down. Good. We're not looking for huge depth and we're not looking for great speed. We're just looking for a nice fluid movement and using it as a warm-up. What I'd be telling Mim to coach her through this particular movement is that we want her to stick her backside out first and we're allowing her knees to stay in line with her toes. So we don't want her to, I'll show you what not to do. If you come down and bring your knees together, that's the position that we want to avoid. We want to maintain that position. Nice and warmed up. Yeah, beautiful. Okay, take that one off. We'd probably do maybe 3 sets of 10 to 12 of those. If you've got athletes that are good enough, you can definitely go to single leg. So I might get on your right leg just to show a single leg squat. Similar position. We want her knee to remain on the toe line. We don't want her knee to come inside towards her middle. Mim's pretty strong. Many female athletes wouldn't be able to do that straight away without much training. So start with double leg and if you're able to work your way to single leg. The other thing that we do, which most people may not understand or perhaps even consider when they're doing a warm-up, is warming up the core abdominal muscles. And the reason for that, if I put Mim back in that ordinary position that I was talking about, so in that squat position with her knee coming inwards, single leg if you can, often what you find is that the body ends up in that position there, which creates the knee movement coming in. The stronger that we are through the core and are able to maintain that position inside our centre of gravity rather than being outside, the more chance we've got of maintaining that alignment. So we jump down into a side plank for me. So again, there's a couple of ways that you can do this. You can get a static plank like what Mim's doing here. To make it harder for her, she can have hand up in the air and coming through underneath. So we're getting that rotational. If she's feeling really good, she can lift her bottom leg up into a star. She's doing well. And the last one that you can do is drop your hips to the ground and do a side plank. That's fine. Beautiful. Good. The next one that I would like to show you is the glute bridge. So if you want to chuck that back on. So again, this is a glute warm-up exercise that we would do. So similarly, you'd start with double leg and work your way to single leg, up into that position. At the top, you can hold for a 2 to 3 second count for a squeeze. And what we're looking for here is that Mim's not overextending it over. We're not overarching, getting that unnatural back curve. We're just coming up into that neutral position, squeezing through the butt cheeks and then coming back down. If she's getting really good at this and it's too easy, you can do it single leg. So you float one leg up in the air. The purpose of the elastic resistance band at this point is for the same reason when you're doing the squats. It's pulling your knees together, causing your hip and glute muscles to have to activate to keep that alignment. The other way, or way that you can make this harder for yourself, go up into that position, cross your hands over your chest, and march up and down one leg at a time. Pretty advanced sort of warm-up, but if you can get your athletes to this point, they're going to have nice strong glutes and hamstrings. Beautiful. The last one I thought I'd just go through is a little bit of ankle proprioception. And this particularly is good for not only footballers, but also for basketballers and netballers, because it actually involves using the ball for the warm-up. So they tend to like that a little bit better. I've got here just a balance foam. You can use anything. A Bosu ball is quite common. A couple of cushions that create a little bit of instability rather, of the foot. So if you stand on that for one, good. Level 1 is with Mim with her eyes open. Level 2 would be with your eyes closed, and it makes it a little bit more challenging. You start to see her wobble a little bit. And what's really important to highlight is how hard her ankle's having to work. So what you can see is all the little ligaments and proprioceptors starting to fire in through there. We do this quite often. We involve the footy as well. So I wasn't prepared well enough, but often we'd be here getting Mim to balance and we'd be handballing the ball. We can get her to kick on her opposite foot while she's stabilising on the foam. For netballers and basketballers, you can get them to shoot, pass, dribble, all the skills that are required for their particular sport. So that's a really, really common and really popular rehabilitation, prehab, and also sport-specific program. That's about time for tonight. I don't want to go too far over. I'm happy to take some questions if you would like, admin team. All right, cool. So we've got a question that's come through here. So in regards to ACL rehab and rupture, does everyone require an operation? The short answer to that is no. As I mentioned before, people often get put into a category of being a coper or a non-coper. And for example, if you were a tradie, a young tradie who is up and down ladders and requires knee stability for their occupation, you're probably more favoured to end up having surgery, just again because of your occupation and those sort of things. If you're a 45-year-old who is not trying to make the Olympics for any particular sport or had no plans to go back and playing pivot sports, you may end up getting away with not having surgery. But I certainly would recommend everyone to consider non-surgical management, or at least have the discussion. Long gone is the thinking that every player or every person who has an ACL rupture has to have a reconstruction. There's a lot of evidence out there at the moment, and it's certainly growing in its popularity, that if you can do a lot of work before surgery, or do a lot of that strengthening work, that most people actually gain back the level of stability that they require to live their life as if they had an ACL in the first place. So it really does depend very much on your own personal situation. What we're seeing in the elite sport and athletes at the moment is we don't have anyone, I don't think, that's playing without an ACL at the moment, or not that we know of anyway. Most people, or most players who want to return to sport, will have an ACL reconstruction. But yeah, watch this space, because I think there's going to be a lot more evidence coming out in the next little while. Being an AFL player, how do you feel about people saying AFL is too rough for females? How that's opening a can of worms. There's a lot of factors that go, I guess, into my answer with this. And whilst we've talked a lot about tonight about how the fact that the ACL injuries, and I mean injuries in general, are much more prevalent in the women's sport than what it is in the men's at the moment. There's a whole heap of factors that go into that. And what I've often, a lot of people who aren't as invested as perhaps what I am in the sport don't realise is the level of commitment that it takes to play at the elite level here. And, I think it's a little bit irresponsible to compare the men's and the women's at the moment, because we're not on the same level playing field, in the sense that, we're part-time athletes. Everyone's still working. So juggling working commitments, sporting commitments, relationships, life outside of our sport and our jobs. Whereas the men at the moment are full-time athletes. So that is their job. There's a lot of resource discrepancy as well. So, we don't have the level of access to physiotherapists, doctors, nutritionists, rehab coordinators, recovery methods, and all those sorts of things in comparison to the men. So until we can get a level playing field and compare apples to apples, it's really challenging when you hear in the media that it's too rough or too dangerous for females, because I just don't think that we have the level of comparison or the knowledge to be able to compare it at the moment. From a personal point of view, I absolutely disagree. I think, there's many success stories, and, we're paving the way for a generation of young females who, will have a choice whether they choose to play football or not. Beautiful. I think we've got to wrap up because we've run out of time. But I do have something to say about next session, which I must make sure that I talk about. There you go, guys. Sorry, Todd, you're going to be quite upset with me. There is further instructional videos on the YouTube page. If you just search for Elastoplast ANZ, subscribe and like, you'll see all the videos from season 1 of the Taping and Movement series. And I think that's it from me tonight. So thank you so much, everyone, for joining and listening in. And yeah, hope to see you out at the AFLW pretty soon.